Welcome to part 2 on our series of yoga, mindfulness, and body-based interventions. Before we start today's session, I want to give us a short warning. This is a trigger warning and a reminder to practice self-care. So although in this course, in this video, we're not going to specifically discuss trauma experiences, some of the material related to trauma treatment can cause distress, especially if you've experienced something similar in your life. So if at any point you need to take a break to take care of yourself, please do so. This might mean that you pause the video, you take a break, and you go and do something else for a few minutes. This might mean that you distract yourself by doodling, drawing a picture, taking a few deep breaths, or even playing with fidget toys. Any of these things are absolutely fine. Please take care of yourself as we go through this series. First, let's take a moment and settle in. So you might be seated. In body scans, sometimes we lie down, but this will be a fairly short one, so you might just stay in your chair. But stay in a position where your feet touch the ground and where you have a nice tall spine. And then begin to notice your feet. You might feel your feet on the ground. If you can, see if you can not wiggle your toes, but just be in stillness as you move through this. Bring your awareness to the rest of your feet, the tops of your feet, the bottoms of your feet, your ankles, and notice any sensations that are happening in that part of your body. Slowly begin to bring your awareness up into your legs. Notice your lower legs, your calves, your shins. Notice your knees and any sensation that might be present there. Bring your awareness to your upper legs. Notice the front and back of your thighs. Continue to draw your awareness up. Notice your hips, your back body, your shoulders. Notice your belly, your chest, and perhaps even the movement of your belly and chest as you breathe. Bring your awareness to your arms and notice your upper arms, your elbows, your lower arms, wrists, hands, and fingers. Notice your neck, the back of your head, your face, and the entirety of your head and face. And then bring your awareness to your entire body and notice your whole body. What do you feel in your body in this moment? As you finish, you might begin to blink your eyes open, bring your awareness back to the screen. If you've noticed that some part of your body needs to move or stretch, absolutely take the time to do that. And then we'll begin to explore some ideas and information around trauma. So first of all, we need to talk about what is trauma. There's so many different definitions and ways of looking at trauma that it's important to know what exactly we're talking about. So first, we have the American Psychological Association definition. This is the definition that you will see in many textbooks and many different articles. We see that trauma is an emotional response to a terrible event, such as an accident, some kind of assault, or a natural disaster. When these things take place immediately after the event, shock and denial is very, very normal. But then we start to see longer-term reactions, and this is more where the problems come up. This is where we see things like post-traumatic stress disorder. And these longer reactions, we might have unpredictable emotions. You might be very unpredictable and unsteady with emotions fluctuating quite a bit. You might have flashbacks where the memory of what took place is so strong that you don't know if this is taking place in the present moment or if it happened in the past. Sometimes there's relationship issues based on all of these different things that are taking place. And sometimes we even see physical symptoms like headaches or nausea. This is why the body is so important to bring into our interventions. All of these feelings are normal, but some people have more difficulty than others moving on with their lives. One of the things that we can look at to help is those body-based interventions. However, we have the American Psychological Association's definition that really looks at the event of what took place. What is really important is to not just look at the event. We need to look at the body's reaction to the event. Because when this terrifying event takes place, we're going to see the body moving into different reactions such as flight, fight, freeze, or fold. The body will prepare to do whatever it needs to do to survive in the moment. And all of things are okay. But what we need to explore is, once this event has happened, once the body has gone through these different events to prepare and keep yourself safe in the moment, what is happening after that? Are we able to come back and find some kind of equilibrium or safety in the body? Or is this now unbalanced and we need to do some additional assistance like therapy or body-based interventions to help find that equilibrium again? So one of the things that's very important for people to know is how we make these survival decisions. So one of the things that many people don't understand is the way trauma is stored in the brain and the way the trauma reacts when it takes place in the brain. So trauma is stored in the back of the brain in the amygdala close to the brainstem. This part of your brain will create a mental model for safety or danger. And this could be based on other experiences in your life. This could be based on many different things, but this is the part of your brain that is going to say, we're going to make a decision right now. This is all related to the body's sympathetic nervous system. So first we need to look at the low road. The low road is the part of your brain that looks at that connection from the brainstem into your body that makes things happen very, very quickly. So if you are in a situation where your body is making a decision of how to stay alive in this moment, it's not going to come up to this thinking part of your brain because that takes too much time. It's going to come right from the brainstem and not take that extra 3 or 4 seconds that might mean the difference between life and death. So this is what we call the low road. This is also sometimes called the reptilian brain because it was developed first. And this is where things happen so fast, you don't get to make a decision. You don't get to consciously think and decide what you're going to do. The other part of our brain is the high road, and that's our neurocortex that's up near the front of your brain. That's the part of your brain that's going to make a conscious decision of how to react to some kind of stimuli. This takes a lot more time. That a lot more time might be 3 seconds, but again, that can be the difference between life or death in some situations. This is the part of the brain that is sometimes considered the mammalian brain because this took a little bit longer to develop. So we see that what takes place in a trauma situation is that the person does not get to decide what they're going to do. that person's body, coming from their brainstem, is going to prepare to fight. They're going to prepare to run away. They're going to do whatever they need to do in that moment that's going to give them the best chance for survival. When you work with people who have been through trauma, it's really important for them to understand that they did not get to make that choice in the moment. Their sympathetic nervous system, that low road part of their brain that's connected to their amygdala and making that immediate decision, decided for them. Some people might have a lot of shame or guilt about how they reacted during that trauma situation. So this is really important that we stress how much we do not consciously decide what our bodies did, how we decided to respond to this threat. So another way of looking at this that becomes very important, is what we call the big T's versus the small T's. So big T's are going to be those traumas that everyone will say, yes, of course, that's a traumatic experience. A car accident, some kind of abuse, a natural disaster. Of course, we're all going to say, yes, that was traumatic. And that's where we have that connection in our DSM-5, that manual for mental health disorders, that says one of these big events must have taken place for someone to have post-traumatic stress disorder. However, this is not taking the body into account. We all have small t traumas as well, and these can sometimes even be diagnosable. So one example that I often see is when we're looking at something like a child who's been ill and has been in the hospital, or maybe a child that goes to the hospital for a routine procedure. Maybe they're having their tonsils taken out. Their parent is going to say, no problem, this is safe, this is healthy, this is what we need to do to take care of our child. The child does not understand what is taking place. So the child feels like their life is at risk, and their body is going to respond as if their life is at risk. They're going to go into that sympathetic nervous system reaction. They might go into that part of their brain that's going to say, I need to do something to stay safe. And when we're looking at the reaction of the body for how we look at trauma, that's when any of these things that might not seem like a big deal to us in general can actually become a traumatic event. Our bodies are responding as if this was trauma. So we have 3 different ways that our body tends to try to deal with a trauma, whether it's that big T trauma or that small t trauma. So we might have hyperarousal. That's going to be when you're always on high alert, you're always looking around for the next danger. Your startle response might be very triggered. So a small sound might make you jump. You might be very angry and irritable and not really know why, or not be able to sleep. When this happens, our baseline of arousal is highly elevated so that the person is always looking for danger in all situations around them. Another way that we see this taking place is through intrusion. So this is where people are reliving events as if they were happening right now. This is where we see things like flashbacks or nightmares, when the person can't even tell if this event is happening in the present moment or if it's in the past. This is our brain's attempt to try to make sense of the memory. Because of the way our brain stores our trauma memories, it's different than our normal memories. So this is our brain trying to sort it out, but unfortunately it's in a way that causes a great deal of distress. We also see constriction. So this is where people start to avoid anything that reminds them of the trauma. So they'll start to withdraw from other people. They'll start to withdraw from parts of their life. And this can gradually happen over time. So maybe one time they go to the grocery store and they play a song that reminds them of the trauma. Now they're not willing to go to the grocery store. Maybe another time they take a walk and they saw someone that reminded them of a person that caused them harm. Now they don't want to take a walk. So we see people continuing to withdraw from different situations. They're narrowing their area of perception and living a more impoverished life. Sometimes this begins with some dissociation that could take place at the time of the trauma that's trying to separate that pain, rage, or terror that's taking place. So we've mentioned some of these terms about the nervous system. How does our nervous system fit into all of this? So we have a basic overall system called the autonomic nervous system. This is the part of our nervous system that regulates involuntary psychological processes. Our autonomic nervous system has two different branches. When we move into those survival situations, our bodies are going to go into the sympathetic nervous system. This part of our body is what prepares us to do something to protect ourselves and to get ourselves out of these dangerous situations. So when we're in this system, our heart rate and our breath rate will both increase to get oxygen and some extra energy into our muscles so that we can be prepared to do what we need to do to protect ourselves. We're going to see our pupils expanding. More oxygen is moving through our bodies. We're going to have adrenaline and cortisol being sent through the entire body to give us that energy to do what we need to do. So the sympathetic nervous system is what takes care of us in that moment when something needs to happen. In general, when we're faced with these situations, our parasympathetic nervous system, the other branch, it kind of goes offline. So this means that anything that's not going to keep us alive in this present moment, in this dangerous situation, is going to take a back seat. It's not going to be as important. So our immune system, our digestive system, all of our rest and digest parts of our system that keep us healthy for the long run, it's not working any more than necessary in this moment. So we're going to talk a little bit more about the sympathetic and parasympathetic nervous system in the next part of our video series. One last thing that is important for us to note for today. What is the impact of long-term stress on our physical and emotional bodies? When we have situations of high stress, our bodies react very much like they do when their life is in danger. We go into that sympathetic nervous system that's prepared to do whatever it needs to do to keep us safe in the moment for whatever might happen next. So what can happen in long-term stress is maybe you're worried about, you have a presentation coming up for your job. And if you don't do well on this presentation, you're worried that you're going to be fired. And if you're fired, you won't have an income. And then you won't be able to pay for your house. And then you're going to be homeless. This can be seen as a threat to our nervous system and to our body's safety. So our body is going to react in that way, just like it was in actual physical danger. And often we live more and more in this mode where we're in our sympathetic nervous system because we're always looking for what we need to do in our high stress situations. This can be work, school, lots of different things, but it causes us to carry excessive worry or stress about our long-term capacity in our bodies. The same thing is going to happen in these settings. This means that our parasympathetic nervous system is not working well. It's going offline and it's putting more emphasis on the sympathetic nervous system to take care of what you need to do right now. When our parasympathetic nervous system is not working to its fullest capacity, that's when we get sick. That's when we have digestive issues or we can't sleep. So one of the things that we can do is use these different body-based interventions to help shift our nervous system back towards the parasympathetic nervous system. This is going to help us improve both our physical and our mental health. So in our next part of this video series, we're going to explore a little bit more about this. We're going to look at the vagus nerve and how that plays into the sympathetic and parasympathetic nervous system. And we'll explore a little bit more about how some of these body-based interventions can be used to help in all of these different life situations.